Hi, everyone. Welcome to Webinar Wednesday. My name is Tara Garrity. I am the founder of Making Cancer Fun, and I'm excited that you're joining us for the next little bit. Today, we've got a great topic. We're going to be talking about what to do when people are staring. So we'll give everybody a second to hop on. I'm just going to make sure that this is working on the other end. I'm wearing my headphones today because we had a lot of landscaping going on outside. It was pretty noisy, but I think the headphones will lower that noise. And so today's topic is really relevant, whether you have a cancer child, a kid going through cancer, or just any parent who has a child that looks different. And that could be from special needs, that could be from all different kinds of reasons, right? And we're going to kind of talk about how do you handle that? How do you handle those stares, those glances, and what we did? So I think it's really important to recognize that when a child is going through cancer, they are going to look different, which is one of the things as parents is really tough for us. And I remember the first time I saw a bald kid in person, and even back to when my daughter was first diagnosed and, she had neuroblastoma. So they were pretty certain she had neuroblastoma in the emergency room, but we did have to wait those few days for the actual biopsy to come back to confirm it. And I remember, don't you have those moments? They're like memories, they're like movies that you could play over in your mind. And I remember that moment that the oncologist called to confirm that, yes, she had neuroblastoma. And of course, you have so many questions in that moment, but the question that really sticks out to me was the last one I asked her. And I remember saying to her, I know this is kind of like an odd question. You're here, you're finding out your kid has a high risk stage 4 cancer. Like, this isn't the first question you go to, right? But this was the one that was the most important to me. And I said to her, I know this is a really odd question, but is she going to lose her hair? And I felt embarrassed asking that in light of the gravity of this situation. And she was very kind and she said, no, that's not, a strange question. And she said she is going to lose her hair, and that is the outward sign of the disease. And there was something about that losing her hair, that she was going to look so different, that was so scary to me. And when we got transferred out of the intensive care unit up to the oncology floor, and I remember that, first night walking down the hall and seeing this mom and her son walk in front of me. And it was the first time I really saw a bald child in person, that wasn't on TV, that wasn't for a poster to raise money for cancer, but live and in person. And I remember feeling like I was going to pass out in the hall on the spot right there. Like, how am I here and how is this my life? And so all of us, I think, have different emotions and experiences when we get this new diagnosis. And whether it's cancer or whether you have a child that at birth you find out, wow, this isn't what we anticipated, this isn't what we expected. And for some people, the way that they look different is going to be a season. So for example, Emily lost her hair for a season. She has hair now, but there was a season that she didn't. But there are other things that look different that will be more lifetime. Now, this could be if a child who has to go through an amputation. They're always going to have something now that looks different about them. Emily wears hearing aids from her chemotherapy. And so, I am very open about that. Finding out about those hearing aids and that hearing loss was absolutely devastating to me. She was doing her workup for her bone marrow transplant, had no idea that she had lost her hearing until they did that hearing test, and just being overwhelmed with anger and sadness and grief. And here you are, you're in the midst of the childhood cancer world, right? This kid's got a bald head, she's got a feeding tube, all this other stuff that's going on, but it was the hearing aids that bothered me so much, because all of those other things I felt were temporary. They were going to go and they were going to go away, and then we could go back to life, before cancer, and it would be normal, whatever that was going to look like. And so hearing aids were going to be this constant reminder of her cancer, that for the rest of her life, she would look different. And I remember that absolute anger at that cancer was going to do that. It was going to leave its mark on our life. And I remember walking back, through the hospital from having that test and carrying her, and every step just feeling so like depleted, like somehow cancer had won, because now it was going to leave these hearing aids with her forever. And when we got up to our room, the child next to us had while we had been gone, had the colors of life put on their door. And that was a signal that child had been moved into hospice. and that their battle was really over. There was no more fight to fight. And in that moment, that perspective, smacked me in the face of, okay, she might look different and this might be different, but we're still in the fight. And be grateful that you're still in the fight. And so I've had both sides of the temporary, where you're looking really different with the bald head and the feeding tube. She had a feeding tube for most of her treatment. And so clearly when you go out and you see a kid with a bald head and a feeding tube, you kind of know they have cancer. The bald head, you might wonder what else is going on. If you're familiar with alopecia, you might wonder about that. But certainly when you've got the bald head, the feeding tube, at one point she had on, she had the bald head, the feeding tube, the hearing aids, and then had these orthotics, these big, huge orthotics on her feet. I mean, it was just, she was with a PICC line and everything was brightly colored, she clearly looked different. And so it's interesting to see how people respond to that. People look, kids look, then people try to get the kids to stop looking, and everybody has this interesting reaction. And I think it's important as parents that we remind ourselves that it's normal. It's normal that people look, and it's not necessarily to be mean or cruel. It's that we are drawn to things that are unusual or different or that we wouldn't normally see. And so people were drawn to looking at her. And, it's interesting to see the difference between an adult and a child, right? An adult looks and then realizes they're looking and then stops looking, but wants to keep looking. And so they're trying not to act like they're not looking, but they are kind of still looking because we are fascinated with things that are different. Where children, they're not that politically correct. They go right up and stare at you. And you can see them. And then, of course, that makes parents super uncomfortable, right? Because they're looking, but they don't want it to be obvious. And now their kids are making it super obvious. And so now they're super nervous. And they're like, stop looking, stop looking, stop looking, which is even more obvious. And so hopefully we can kind of step back a little bit and go, okay, see the comedy in this scenario, because they are probably way more uncomfortable than we are. I was used to seeing her with her bald head. I was used to seeing all these strange things sticking out of her. And so that stranger was probably way more uncomfortable with that situation than I certainly was, and particularly for children, they really don't carry the same judgment that maybe an adult does. We tend to be, once we become adults, we judge everybody. That just becomes part of, it's very rarely that, somebody can really approach life with no judgment. And we can kind of get into the why that is and what's going on psychologically, that we judge people to characterize to make ourselves feel better. But most of the time we can say that judgment truly is more about us than the person that we're judging, right? And so we know that sometimes those stares as from an adult feels different because it feels, and maybe not in the situation, but we know that usually there's a judgment attached to that. When children are staring at other children, there's usually no judgment. It's usually just curiosity. They are super curious. This person looks different. And we encountered this a lot in kindergarten and first grade. Emily went to 2 different schools. And so she had hearing aids in kindergarten, continued to have hearing aids in first grade, but those first graders, also responded the same way the kindergartners did. So we went through a year with these kindergartners kind of sticking their fingers. They would go up and literally stick their finger in her ear and say, what are those thingies in your ear? And then we'd have the same thing happen in first grade, where the first graders went up and they'd stick their fingers in their ear and be like, what are those thingies in your ear? And Emily's wore hot pink and orange hearing aids. Ironically, she's now 13 and she still wears hot pink and orange hearing aids. She's been given the opportunity to make the more inconspicuous ones, and she's just chosen not to. She said, I'm comfortable with these. These are what I'm used to. This is what I'm going to wear. And even now, I find now that she's older, I am so used to seeing her with something different with these hearing aids that I don't even really see them. And every now and then we'll have a family that hasn't met us, or the first time they see her with her hair up, and they'll go, oh, I didn't know she has hearing aids. And I have to remind myself, if I was a parent who saw a child with hearing aids not being around one, that would be really different to me. I might even wonder, well, can she hear? Do I need to speak louder? I might feel uncomfortable, not because I'm a mean, judgmental person, because it's different. And so I think if we can approach these situations where our children look different with an understanding that it's, most of the time it is not meant to be mean, it's truly out of a curiosity, then we can have a more compassionate conversation with our children. So today we're going to talk about how do you prepare for that, because I think it is much easier to determine how do you want to handle those situations than when they're kind of confronted with you and now you have to think on your feet and you tend to be more in a reaction mode. A lot of what I talk about and teach is how do you move from reaction to response. When we react to things, it's really the outside things that have the control. It's the person, it's the situation. We kind of give up our control because now we're just in reaction. Versus if we can prepare, then we can choose to respond. And now all of a sudden we have the control. How do I want to respond to this situation? And so when we have medically, frail children or children going through medical treatments, or maybe just, this is going to be something that they have their whole life, a child who's born with a deformity or something that looks different. If we choose how we want to respond, now we're the one in control of that situation. So I think the first thing is to really determine your child's understanding and the age of your child. So in my case, Emily was 3.5. And so at that age, it wasn't so much about talking with her about how she wanted to respond. It was me choosing how I wanted to respond for us. Now that she's older, in that situation, I would have a conversation with her about, how do you want to respond to this? Do you want mommy to respond to this? Do you want to respond to this? If you have an older child, they might say, hey, I want to be the one to respond to this. I want to choose how to address these stares, where, a 3.5-year-old isn't going to do that. And I think there's something super empowering, right? To give our child the chance to choose, because a lot of times we assume we know how they'd want us to respond. And yet as they get older, they might have a completely different idea than what your idea is or what my idea is. And one of the hardest things with children in those situations is that they don't have a lot of control. And so anywhere that we can find places to hand them back a little control is always a positive win, right? And so this is one of those places to say, hey, people are going to be staring, and that's not because they're hurtful. That's not because they're mean. That's because, they've probably never seen a bald kid, or they've probably never seen a feeding tube, or, this might be unusual. And so how do you want to respond? And of course, my platform is always when you respond with fun and light and life-giving energy, there's something super healing about that. And there's something that's healing for our children. Our children are a mirror of us. And so if we are angry that people are staring, if we feel hurt that people are staring, if we're responding negatively, then what we're teaching them is that's how they should respond too. And I didn't want my daughter to have that. So I'll give you an example. One of the things that we had probably the most stares with was the feeding tube. It's the long yellow tube that went into her nose, was taped across her cheek, hung over, and then kind of hung down to about here. And it was just an odd looking thing. And I did find it curious, and every situation is different for children and for your child, but I actually found we got more stares and more questions about the feeding tube from other kids than the bald head. Like they almost didn't really seem, particularly when she was really young, they didn't seem to notice the bald head as much as they did the feeding tube. The only time her bald head really came into question was when she was kind of done with treatment. She started to go back to preschool. Her hair hadn't grown back. And even though she was dressed top to bottom in pink and purple, people would refer to her as a boy as a lot. And she'd be like, no, I'm a girl. And they'd be like, other kids would be like, no, you're not, you're a boy. And, this became a really good opportunity to have a conversation. And, we talked about, and she was, about 4 or so at the time. 4 or 5 years old. And so we talked about, well, why would people think you're a boy? And it was because she had this kind of like really short hair that was just starting to grow in. And so we talked about what does it mean to be normal? And the only thing that normal means is it's just kind of like what everybody else is doing. It's not right or it's not wrong. And it doesn't mean you're not normal. It's just this isn't what everybody else is doing. And so we talked about the fact that most boys have short hair and most girls have long hair. But that's not always the case. And we talked about people that we knew who were boys who had long hair. And we talked about girls that we knew that had short hair. I wanted her to feel as normal as possible, that having short hair is something that some girls choose that. And just like some boys choose to have long hair, and there's no right and there's no wrong, it's just people aren't used to seeing that. Oh, I have a little fuzz on me. People aren't used to seeing that. And so it's different, right? And that her hair would grow back and then it would be up to her whether she wanted to keep her hair long or short. And so I think when we can pull in examples outside of the medical world, right, of people outside that, then it helps empower that there's nothing wrong with them. That was a big thing of feeling like there's something wrong with me. So going back to the feeding tube, that was probably the one that we got the most stares with. So we would go out and it could be on, a playground. It could be sitting at a restaurant. It could be anywhere. And kids would stare at this feeding tube. So I chose that the way I wanted to respond was I wanted to address it head on. I thought for me and everybody, this is why it's important we have this conversation and you decide ahead of time what works for you. For me, it was more uncomfortable to not address it because I knew these kids were looking. I knew these parents were uncomfortable and that just made me more uncomfortable. So I'd rather just address it head on. So I used to crouch down and get eye level with the staring child. And I'd say, you're looking at that funny thing in her nose, right? And they'd be like, yeah. And I'd be like, do you want to know what it is? And of course they'd be like, yeah, we do. And I'd be like, she eats through it. And they'd be like, what? And I'd be like, I know, cool, right? I said, so that thing hooks up to food and we put food in her nose. And they'd be like, whoa. And I'd be like, I know, really cool, right? She can eat through her nose. Isn't that funny? And they'd be like, yeah. And you know what? And that would be the end of it. And the way I just described it to you is the way that I would talk to these kids. I'd be like, it's pretty cool, right? Or if it was an older kid, I'd be like, hey, you kind of want to know what that is in her nose, right? They'd be like, yeah. I'm like, I know, it's kind of weird. So we actually put food in there and that's how she eats. Because right now, she can't eat through her mouth. And so we feed her through her nose. Isn't that weird? And you have to remember, kids love weird stuff. Like kids like to put string in their nose and to see if it will come out their mouth. Kids like to eat their boogers. Like kids love gross, weird things. It's not scary. It's actually kind of cool. And using positive questions like, pretty cool, huh? Guess what they do? They go, that is pretty cool. And then Emily would kind of grin because now they thought it was cool. And the whole situation would be over in maybe a matter of 2 minutes. And the other parent, of course, would be greatly relieved at this moment, right? Because now they're like, oh, okay. So that was how I chose to kind of address those stares. I just wanted to head on address it, make it fun, make it so that she didn't feel uncomfortable. I didn't want her to be kind of picking up on people staring at her. I wanted the situation over and I wanted to address it in a way that it was fun and it was cool and it wasn't weird and it wasn't scary. It was just like, hey, this is kind of fun. And we did the same thing with her hearing aids. As she would get hearing aids and kids would be like, what are those thingies? I'd be like, oh, well, they help you hear. You know how like somebody has glasses and they help you see? And they'd be like, yep. I'd be like, well, hearing aids help you hear. And sometimes kids, depending on their age, they might be like, well, why does she have to wear them? And I would say, well, she took a medicine when she was really little and it kind of made her ears a little kind of go to sleep, some of those hairs in her ears. And so the hearing aids kind of tell them to wake back up. And they'd be like, oh, okay. And this was one of the things that I have learned, over the years is that when we don't make it a big deal, they don't make it a big deal. When we make it a big deal, then all of a sudden we're telling them it is a big deal. And, and I've often said to her with her hearing aids, because she's, as she's gotten older, she's had a lot of kids ask about the hearing aids, is that again, they're not trying to be mean. Kids are used to seeing people with glasses. Years and years and years ago, it would be the kid who, wore the glasses at school that was kind of maybe made fun of or picked on because it was different, right? They were called names like Four Eyes and things like horrible things, that they had to we had an environment that, children who wore glasses were so different. Where now, my gosh, by the time she was in elementary school, a bunch of the kids in her class had glasses. Now it's quote normal because more people are doing it. Well, hearing aids, the only time somebody might ever see a hearing aid is in a grandparent or in somebody who's elderly, or they may have never seen a hearing aid and they probably have never seen one on a child. And they probably, if they did see one on a child, it wasn't hot pink and purple, right? So it's really different. And so when you can explain it in a way that makes sense to something that they already understand, oh, people wear glasses because it helps them see. Hearing aids help them hear. Oh, no big deal. Again, it's all about the no big deal. So one of the chapters in Making Cancer Fun, if you have the book, now if you don't, just grab a piece of paper and pens, it's fine. You're going to write down the same questions. If you have the book, it is on page 102. But if you don't, you're just going to write it down. is deciding ahead of time on how you want to handle unusual stares, points, and questions that can empower both you and your child so you can respond instead of react. And so the first thing to do is to really make a list of what are some of the things that people might notice about your child that look different. What are the things that are different? Is it obviously, the bald head, or maybe it's scars? Now Emily has a nice array of scars all over her body. And we recently had, my gosh, just a few months ago, we went out with some friends and she had on her bathing suit, and one of the girls had never seen her in a bathing suit. And she knows my daughter and has spent time with her and everything, but had never seen her in a bathing suit. And she goes, what are all those things all over her? And again, this is the innocence of a child. And this is where it's important to communicate with our child that these are innocent questions. They're not hurtful, mean, judgmental. They're innocent questions. And her question was, what are all these things all over her? And I said, oh, well, when she was really little, she had to have a bunch of surgeries. And so those are all of what we call her courage scars. And she said, oh, do they hurt? And I said, no, you can ask her. And Emily was like, nope, they don't hurt. And she was like, oh, okay. And that was it. And we gave them a fun name. They're courage scars. You can name them whatever you want, right? And it was just fun and it wasn't a big deal. Now, had we not addressed it, that little girl probably would have spent all afternoon staring at those scars, right? Which would have made everybody uncomfortable. So that's why I'm a big believer of just addressing it head on. But guys, this is things like she's 10 years, out. Well, maybe not quite that far, but she's years out. And we still have people who are going to stare, who are going to look. And I think it's when we can make it no big deal and they make it no big deal, that will ripple out as they get older. So if you follow any of my social media, you know about this summer, what happened is Emily was going into 8th grade and she wanted to wear a bikini. And we live at the beach. And so all the kids are at the beach all the time. And I really didn't want her to be in a bikini. And I know some people put their children in bikinis when they're like 2 years old, but just for me, I didn't want her in a bikini. I was like, you're only, you don't need to be wearing a bikini. And she said to me, Mom, you should encourage me to wear a bikini. You should want me to wear a bikini. You should be glad that I'm not ashamed of my scars and that I'm going to wear a bikini even with my scars. So you should actually encourage that. I mean, how do you argue with these kids, right? This is why they're miracle kids, because you're like, you're right. I can't argue with you. And she got the bikini. Clearly she won that argument. And I'm so proud of her because she is so confident. I wish she was, maybe pull down the shirts a little bit more, but she is so confident that she will wear, she wants to wear a crop top. I don't want to wear a crop top, but she wants to wear a crop top. She doesn't care about these giant scars all over herself. And I think that's because we've never made it a big deal. They're nothing to be ashamed of. People have different things. Everybody has different things, right? There is no quote normal. Everybody looks different. And these are really your courage scars. These are things that you should be proud of. They show how strong you are. So I think it's important that we kind of sit down with your kid. And again, maybe this is something that you do for yourself because you want to prepare how to respond, or depending on the age of your child, this is something that you could sit down and do together and say, hey, have you noticed when we go out, sometimes people kind of don't know what to expect, or, what do you think are some things that maybe people might notice that would look different? Now, of course, our whole thing is the miracle kid, and that, she was a miracle kid, and we talk all about childhood cancer kids are miracle kids and kind of their own special superhero. And so that you can even make it fun is, people don't often see a miracle kid. They don't know what to expect. How often do you see a superhero or somebody really powerful in public? You don't often see somebody like that. It would be like if, Batman showed up, people would be staring, right? Or if Wonder Woman showed up, people would be staring. So people don't expect to just see a miracle kid when they're walking down the street. So what do you think they might notice that's different about you? And then you can pinpoint the things. And what's interesting is that I've learned that what we think is a big deal, our kids don't, and vice versa. So just because it's the first thing that you think people might notice, I thought the bald head would be what people noticed first, right? And the little kids, they actually noticed the spaghetti hanging out of her nose. I'd say it looks like spaghetti, right? They'd be like, yeah, it looks like spaghetti. That was more interesting to them. So what is it that people notice? And And then for each thing, you want to decide ahead of time how you want to respond to those curious looks and those questions. So for example, you might say, someone might be curious about, and I like that word, it's not as threatening. Someone might be curious about why you have a bald head. Someone might be curious about why it looks like there's spaghetti out of your nose. Someone might be curious about, why you only have one leg. They might be curious about that. I know a mom who, oh my gosh, her daughter is the most beautiful miracle kid. And this mom has just so embraced having fun along the way. Her daughter's an amputee, came down with her diagnosis, I think around 6 years old, and has the t-shirt that says, $1 for the leg story. I mean, how fun. Her first Halloween, just this woman, it blows my mind with her creativity. The first Halloween, her daughter was a pink flamingo with one leg. I mean, talk about preparing her child to be confident about the fact that she looks different the rest of her life and doing it in such a fun way. They now, she posts funny things on Instagram about like where the leg is going. The more we can make it fun and light, and that's never to take away from, I am sure, behind the scenes, the grief and the sadness that this mom experienced knowing that her child was going to have to lose her leg. I mean, we never want to minimize those moments that we have as parents of just deep grief for the loss of my child has to go through this. And it's okay to have those moments. What I want to do and what hopefully you want to do is move out of that moment and experience it for a moment, but not stay there. And so using words like somebody might be curious about that, that's very different than somebody might feel, might be staring about that, right? They might be curious about that. And then what I would do is come up with 2 different ways. If it's an adult who's curious about that, how would you want to respond? And if it's a child, how do you want to respond? And this is where you can also let your child choose. Do you want mommy to say something, or do you want to say something? If you want to say something, what would you like to say? And maybe even giving them the opportunity to practice that ahead of time so that they're prepared on how they want to say that. As adults, we do this all the time. If you have to do a presentation for work, or you have to go up and you speak somewhere, you go over what are you going to say ahead of time, and you practice so you're not put on the spot. And giving our children that same experience to say, what would you like to say at that time? What would you like to say to that person? What do you want me to say? How do you want me to handle that? What would make you feel comfortable? Would you rather? Do you want me to? And having that conversation and maybe coming up with 2 or 3 scenarios of how you would like to handle that. And you know what? Maybe you never need to use that. Maybe that's just something you put in your toolkit that you have that you never need to pull out. How great would that be? But if you do have that moment where you do need to use it, you've tucked it away in your toolkit. You have it for when you need it. And more importantly, your child knows that you have this backup, this tool for them if they're in an uncomfortable situation. And it may be something that you revisit. Maybe when they're first going through treatment or something, you go and you start here, and then years later, now they're older and they have a different understanding, and you go back and you revisit that. And hopefully that skill will then follow them their whole life, because particularly depending on what looks different, that might be something that they encounter their whole life. Even as an adult, my daughter, I'm sure as, she's in college and stuff like that, people will ask her, like, why do you have hearing aids? What is that from? And how does she want to choose to respond so that she's not stuck reacting? So hopefully this gave you some good ideas, things that you can talk about. We're all about, we want to just support our children, empower our children to feel confident that being different is okay. And that's tough when you're, little. You just want to be like everybody else, right? Adults struggle with that. Adults, we don't like to look different, particularly as women, think about it. You go to an event or a party. What is the first thing you're asking? Like, well, what is everybody wearing? Guys, it's easy. They throw on a suit. Women were like, is it, and they say, well, it's, you can wear a dress. Well, what does that mean? Is that a cocktail dress? Is that a formal dress? How formal? So just think about how we feel. We want to look, that we're, quote, normal, that we're dressed like everybody else, right? And we're adults. And so even more so for children that want to feel normal. And so using words like explaining what does normal mean, because they're going to hear that a lot, oh, that's not normal. Well, what does normal actually mean? all that means is that's what the most people are doing. It actually doesn't mean right or wrong or good or bad or any of things. It's just that the majority of people do that, and so they call that normal. But that doesn't necessarily mean that it's a good thing. You know, it doesn't mean that they're doing the right thing. It doesn't mean that they're doing the thing that you want to do. And it doesn't mean that it has to be you. So if you have questions or comments, you're welcome to put that on. We'll keep this live stream up. In the next day or two, it'll be transferred over to our YouTube station. And then you can join us next week, same time, 12 o'clock for our next Webinar Wednesday. Bye.